Hi, I'm Marla Smith and I'm a women's health nurse practitioner. I was in a corporate marketing for Time Warner Cable, and I decided I wanted to help people. So I went into healthcare, nursing specifically. My first job out of school was on postpartum. I did that for 4 months, but I always knew I wanted to take care of moms and babies and become a labor and delivery nurse. So I proceeded to be on the unit for 4 months, and then I transferred back to labor and delivery, and I spent the next 21 years there taking care of moms and babies, as well as working in the office setting, taking care of GYN patients. It is my passion to take care of teenage patients. They are very important to me because I didn't feel that sense of comfort with the provider when I was their age. So I really try and make it a priority to make them feel comfortable, to know that they can ask me any questions and to know that it'll be confidential. It's my thought process that if I keep one of them from getting an STD or getting pregnant and being able to go on and finish careers and things of that nature, then my job is done. So the most important thing is making them feel comfortable. The first GYN experience that they have is basically what they're going to be expecting for the rest of their life. And if they don't have a good first experience with a provider, then they're reluctant to come back for future appointments and take care of themselves. So that's why it's very, very important to make them feel comfortable and open and honest in the beginning to start their GYN career. I have a passion for hot wings. My favorite come from a local restaurant in Columbia, but I can basically order them off any menu, and if they have Frank's hot sauce on them, that's a bonus. But I absolutely love hot wings, and I could probably eat them 4 to 5 times a week. The biggest influence in my life is my mother. There were 5 children, 4 girls and 1 boy, and we were basically a newborn, a 1-year-old, a 2-year-old, a 4-year-old, and a 6-year-old, and she essentially took care of raising us all while working 6 days a week. And she made sure that we got to Sunday school every week, to the dentist, to the doctor appointments, to our sporting events, and made sure that we were all fed and clothed. And for a mom to do that by herself and raise 5 children that were very close in age, and to have all 5 children grow up to be responsible adults who all have good careers and have managed to stay out of trouble, I think that is very much very admirable to me, and I try and follow in her footsteps. She did not retire until she was 74. She owned a business and worked 6 days a week up until the age of 74, and finally got to retire last year, and now she's getting to enjoy her life. But I have to say that I get my work ethic from her. Most recently, I did a trip to Glacier National Park and Mount Rainier, and prior to that I had been on nothing but beach vacations other than going to Wyoming and Yellowstone. And I just didn't have the appreciation for the beauty that we have here in the United States. And I have to say, by far, going to Mount Rainier and hiking amongst the clouds was life-changing for me. That is an absolutely beautiful place to be, and it's very refreshing. And I would have to say that definitely hiking in the mountains of Mount Rainier was my favorite. I absolutely love my community. I've been there for about 30 years. I actually had my own practice there for 7 years and closed that in 2016 and came to work for Heartland. And it's very nice to work in the community in which you serve people. I believe patients feel comfortable because I am their healthcare provider. Do I get questions in Walmart, Schnucks, when I'm out and about? Yes. It doesn't bother me. I see a lot of my friends as patients, and they trust me with their health care. And so it's very important for me it's a smaller community, a very tight-knit community, very family-oriented. And I feel like having a healthcare provider from their community makes them feel comfortable, and it also gives them access to health care. Many of them, the 3 years between closing my practice and Heartland did not receive health care. They didn't want to go anywhere else. So when I came back into the community, a majority of them made appointments with me again, and it was very rewarding to see that they trusted me and that they came back to see me in the community. So it's very, very important, I feel, to be able to provide health care in the community that you live.